Good morning, and thank you so much for your kind introduction. And thank you as well to SSBMT and EBMT for giving me this opportunity to give this talk about Oncology Outreach Program. And I will somehow highlight the pivotal role of the Clinical Nurse Coordinator. Here are my disclosures, and this is my roadmap for today's presentation. KFSHD belongs to the Eastern Province. This province is the largest by the landmass, but the third populous following only Riyadh and Mecca. In Eastern Province, you can find the cities of Dammam, which is the most populous one, followed by Al-Khobar, Daharan, Qatif, Al-Hasa, Al-Hufuf, and Hafar al-Baten. Why am I mentioning all these cities? Just for you to get familiarized, because I will be talking about the sites for the outreach program. As a tertiary hospital, we cater for the nationals or the citizen of this area, but there are instances also the hospital accepts cases as far as Tabuk and Al Juf, far in the north. So this is the annual oncology report in the year 2016 and 2017. Why am I showing you that past statistics? It's because that is the date wherein the outreach program was initiated. Would like to highlight on the increasing numbers of cases being referred to the oncology center from 2,200 to 2,400. And after it was filtered, in 2016, there were malignant cases of 1,500 cases, and it jumped to 1,700 plus, meaning there is an increment on the number of cancer cases being accepted in King Fahd Specialist Hospital, Dammam. And this data is further supported by the increasing ambulatory visits. So from 2016, there was 45,000 plus, and it jumped on to 49,000 plus with a 7% increment. These are the services that fall under Oncology Center. Just to show you the statistics between the year 2016 and 2017, it's medical oncology who slipped down a bit with 8%, but the clinic that caters for the patients on active chemotherapy treatment have shot up to 6%. The most noticeable increment on this slide is the adult hematology services with a whopping 24%, together with the ambulatory visits in the BMT clinic with 13%. Hence, the Director of Oncology Center at that period, 2017, have thought about forming the outreach program. And the last data, but not the least, is the pediatric ambulatory visit with an increase of 7% on that period. Also shown here is the pediatric and adult top diagnosis with their appropriate percentage. Knowing all of this data that has been gathered between that time frame, the Oncology Center have decided to embark on this outreach program. But before going to an outreach program, let's see what are the steps to go on that pathway. So what is an oncology center program? This is a systematic approach to deliver an oncology healthcare services beyond the hospital to a certain population in the community wherein the population might not have access to these services. And oncology outreach clinic is defined that a clinic set up in another healthcare facility wherein it was initially staffed by the physicians, nurses, pharmacists, and other allied healthcare from KFSHD. This is the roadmap for the establishment of the Oncology Outreach Program. It has 3 stages, and the first stage is the planning. Planning is further divided into 4. Second one is the development of action plan, and lastly is the implementation. The first step in planning stage is to assess and to identify the best location for the outreach service. The hospital managed to establish 3 outreach services, but for the sake of this presentation, I will focus on to the Alhasa outreach program. The next part of the planning stage is the making of the proposal. Making of the proposal or presenting of the proposal to the hospital administration, and also proposal to the health directorate of the city that has been chosen to establish the program. So what does a good proposal should contain? So here are the following questions that must be answered in writing the proposal for an oncology outreach program. First one is, are there underserved population in the program area? If this yes, where are they located? So for the information of everyone, the hospital have established 3 outreach sites. It's in Alhasa, Hafar Albaten, and Katif. What are the main barriers to oncology services for these populations? Basically, for Hafar Albaten and Alhasa, it's the geographical distance. The distance is like Alhasa will reach 2 hours before you get to the mom, while Hafar Albaten is 5 hours to 6 hours drive. Is there a lack of access to oncology services? Yes, because in the areas mentioned, at the time in 2017, there are no cancer care hospital. That's why most of the referrals are being sent to the mom to be attended to. Is there a lack of trained providers to offer oncology services for this population? Yes, that's why cases are referred to us in the mom. So, an oncology outreach program is possibly an effective way to address these barriers. It's a resounding yes. And with this guide of questions, we managed to make a proposal for the administration and for the health directorate of the certain cities. So next phase is the identification of resources under planning. Is there available trained staff? Yes, there are in King Fahad Damam. There are oncologists, hematologists, physicians, nurses, and pharmacists. And of course, the clinical nurse coordinators, well-trained and highly competent. Training of allocated outreach site clinical staff, it has been planned and arranged by the Director of Oncology Center, together with the Chairman of the Oncology Outreach Program, with the Health Directorate of the Alhasa, let's say, city, that their healthcare workers will be trained in the mom for a month or 2, exposed to the ambulatory area and to the inpatient ward. Pharmacists will be exposed in the pharmacy area, so on and so forth, to get that competency developed with them during the transition, and to be of assistance when the team from the mom sets in there to start to initiate the program. Next is, what is the method of transportation? At this case, all the 3 sites, Alhasa in particular, by land. Bus, car, or van driver is provided by the hospital to transport medication and staff to the outreach facility site. And cost-effective analysis. Definitely, this is one of the factor that has to be looked at by the host, King Fahad Damam Hospital, and also by the outreach site. So if they agree it's not only with this hospital that the cost effectiveness analysis comes in. Also put into consideration the patients and the family's financial uh, requirement on this. So instead of traveling from Alhassa, 2 hours drive going to the mom, they will just be driving 10 to 15 minutes because we are bringing in the service to them on their community. And the last phase under planning would be the building good rapport and relationship through collaborative meetings with the key stakeholders, administration of the hospital and the outreach facility, and even the health directorate. So under KFSHD, here are the key stakeholders initiated, of course, by the director of the Oncology Center and assisted by the chairman of the Oncology Outreach Program, with the different chairman of the different services under oncology, the program director for the nursing oncology, and the different allied healthcare representative, pharmacy, laboratory, even mailing services, and of course, the finance department. This is an example of one of the meetings held by the key stakeholders during the time to iron out the moving of Al-Hasa Outreach Program from King Fahad Hufuf to Prince Saud bin Jalawi. So Dr. Hani Al-Hashmi, the director of the Oncology Center at that period, together with Dr. Fahad bin Shamsa, Mrs. Isabel Rose for the program director of oncology nursing, and the rest of the staff and the key stakeholders that plays their own role on this outreach program. Next phase is the development of action plan, and we have already identified that Al-Hufuf in Al-Hasa will be an outreach site. The doctor will visit there once a month initially and check on it, how it goes, would it make it more frequent. Who is with the hematology physician going to the outreach site, and that would be the outreach program coordinator and the driver on the initial phase. What are the types of training that will be held and how many trainings? So we are speaking of the nurses that will be assisting there in the outreach clinic, and if the laboratory or the pharmacy has also to be cross-trained here in the MOM. The supply of medications and the follow-up and the continuity of care activities in the outreach site. So the last phase would be the implementation. Now that we have chosen Al-Hasa as the outreach city, the hospital that has been chosen is King Fahad Al Hufuf Hospital, located in Al-Hasa. The dates that has been agreed upon is last Thursday of the month, and the staff initially that are going there back in 2017 is the hematology doctor and the outreach program coordinator, the driver, and the other healthcare workers will be like the nursing and the laboratory radiologist technician. It will be coming from the outreach facility area. So the outreach program coordinator have created this monitoring plan just to see how does the program is going on, like collecting of data, statistics, the number of patients availing these services, and patient satisfaction, any complaints, and even the number of patients coming back from the outreach, going back to the mom. And lastly, there should be a continuous progress meeting with a specific outreach program site partner. This is to ensure the smoothness of the program and discuss any problems or challenges that has been encountered. And lastly, to continuously provide refresher course and updates to the healthcare provider. This is the process that has been applied in Alhasa Outreach Program back in 2017. Uh, the hematology physician will review the list of patients 3 days before the clinic visit. The outreach program coordinator, he's working more of the admin part. He's the one who will inform the patient by telephone of their clinic schedule and their time. They will go to the King Fahad of Fuq Hospital Clinic. And this outreach program coordinator will also pick up the laboratory tubes from the laboratory phlebotomy area and the TKI or other oral chemotherapy medication that will be delivered on the same day of the outreach clinic. On the day of the clinic visit, the hematology physician will see these patients in King Fahad Fuq Hospital. He will be assisted by a nurse trained in the MUM, but a nurse from the outreach facility. Then any laboratory that will be done, if it is routine, can be carried out by the laboratory department there. But for any special tests, let's say BCR ABL or PML RARAP or APL or myeloma markers, the tubes were brought by the outreach program coordinator. Blood will be extracted by the laboratory technician and it will be sent back in the afternoon to the mom so that the test will be run and it will also be saved in the system. Then the physician, most of the time, will now call the clinical nurse coordinator for assistance regarding the laboratory results, radiology, any imaging or procedure results that has been not reviewed. What do I mean by that? Back on those days, the electronic file is not yet fully implemented. So the file, the hard copy file sometimes is not complete and you have to compare it with the hospital informatics system. So this is what now will drag the clinical nurse coordinator during the clinic visit, as the doctor will have a constant communication with you, either by phone call or you will be replying, sending him the pictures of the results to be explained to the patient. Then, on the last part of the process, after the clinic visit, the physician will decide if the patient will continue following up in the outreach clinic or if there will be changes in the clinical condition of the patient that he has to be sent back to the mom. And if the patient will continue in the outreach, what are the necessary tests for the next visit, and he will write on the documentation that will be placed in the shadow file. Now, this shadow file will be safekept by the outreach program coordinator and a copy of it will be placed on the patient hard file in the medical record in the MUM. And the OPC will also arrange the next visit of the patient as ordered by the visiting physician in outreach clinic. This is the healthcare facility initially used in Al-Hassa, King Fahad Hospital, Al-Hufuf. In the outbreak of the COVID pandemic, the initial process is needed to be revised because of the ongoing lockdowns of cities. Patients are not allowed to enter another city, and imagine I have mentioned that the barrier initially are the geographical location of our patient. So this is the new process. The hematology physician in the clinic or in the ward will hand over the patient case to the outreach physician. This physician is under the outreach facility and it's Prince Saud bin Jalawi. Our physician name is Dr. Naima Al-Musailem. She is a brilliant physician who was a fellow in KFSHD and now a consultant in Prince Saud bin Jalawi. The clinic doctor or the ward doctor from the mom will hand over clinic follow-up, any treatment plan, chemotherapy, ward discharge plan, even those patients for transplant that undergoing outpatient mobilization can be also followed up there for the pilgrastim injection and even the laboratory IV and oral chemotherapy treatment. This time we're giving intravenous treatment in Prince Binjalawi, laboratory tests, and surveillance of lymphoma patients. Now, after the physician had made a handover to the physician in outreach, the clinic and ward nurse has to inform the clinical nurse coordinator that this patient will be transferred to the outreach service so that the continuity of care will not be disrupted. And the responsible person, which is the lead coordinator of that disease, has to be aware where the patient is already following up. On the other hand, if a patient will continue the treatment like a chemotherapy has been ordered by the clinic physician or the ward, the clinic nurse has to hand over the pertinent documents related to the treatment to the outreach program coordinator, who is also changed from an admin staff to a nursing staff. When the patient is seen or receive a treatment in the Alhasa outreach program, any changes, anything discussed will be also relayed by the outreach physician to the clinical nurse coordinator for any new findings and any required care of patient. The clinical nurse coordinator in Tamam is the one now going to prepare the laboratory tubes or get an appointment for a PET CT scan or any other radiology test imaging that is not available in Prince Saud bin Jalawi. Now, also the coordinator need to assist if there are any requirement for documentations or chemotherapy protocol that is required by the outreach physician in Alhasa. If the patient have any changes or in his clinical condition, the physician in the outreach has to discuss it with the main responsible physician in the MAM, and also the CNC has to be informed to transfer back the patient to the care under the MAM. The CNC will be the one arranging the appointments in the clinic or the admission. And the CNC will also inform the patient of their new schedule. This is Prince Saud bin Jalawi, a secondary hospital. So in Prince Saud bin Jalawi, they managed to provide for the outreach at least 3 clinics, 1 oncology, 1 hematology, and 1 for pizza oncology, and even treatment room, 10 beds for adult, 4 beds for pediatric, and 1 procedure room, and even 1 recovery room consists of 2 beds. So this is the clinic room in Prince Saud bin Jalawi, the treatment room, the procedure, and the recovery room. And this is the outcome since March 2020 until December 2021 for the Alhasa Outreach Service. This is combined with medical oncology and hematology adult. On 2020, the clinic visits that the outreach observed is 2,019, and on 2021, it jumped to 3,840 clinic visits. On the other hand, for the treatment, these are a combination of chemotherapy and supported treatment like blood transfusion or electrolyte replacement. From 2020, it was 2,504, and it also jumped to 3,007 on the end of 2021. The conclusion on this presentation is that Oncology Outreach Program has bilateral benefit for KFSHD and the community hospital, but the big winner here is actually the oncology center patients and their families. Patients' trust to their local community hospital has been restored and even boosted. Quality of life has been enhanced among the patients and their families. Local healthcare practitioners more exposure to take care of oncology patients, which in turn develop their skills, with their competence, and they become more confident in cancer care. And every healthcare provider have a special role in the outreach program, but nurses are the backbone of this program. They care not only for the patients and their families, and also for their colleagues. I would like to acknowledge the following staff, those in the task force and the current hematology outreach team. This is their usual day in Alhasa Outreach Clinic when they were accepting the patient. And this is our physician, Dr. Naima Almasailem, how they check on the chemotherapy medication and when they give it to the ambulatory patient who will receive the treatment. And this is, of course, the MRPs on the mom's side and the coordinators under hematology. Special thanks to Dr. Hani Al-Hashmi, the former director of KFSHD. During his term, the Oncology Outreach Program has been initiated. And to quote Dr. Hani, hematology clinical nurse coordinators are the glue that holds a patient's healthcare journey together in the adult hematology and HSCT department across the entire patient experience, and wherever there is someone in need of care. CNCs work tirelessly to identify and assist with the needs of the patients and their families. If there will be any questions regarding this presentation, I will be happy to accommodate them after this session. Thank you very much.